This was a fabulous opportunity for us. We first started hearing from our patients that they were frustrated in being able to access our services, especially in the catheterization lab. We also started hearing from our staff how frustrated they felt that they couldn't provide the care and access that they knew that their patients needed.
We tried to do it ourselves. You know, we had a lot of smart people scratch their head, look at this problem, and I think that elephant in a dark room, when everybody puts their hand on the elephant and feels a different part, but doesn't get a picture of the true problem that we had. And I think we were greatly benefited by having somebody come in from the outside, very experienced in this area, that could look at the whole elephant and explain, listen, there's other issues, there's other bottlenecks, there's other efficiencies or challenges that you might not have recognized, and we need to have that all out on the table. And it was a wonderfully enlightening experience because just the process of what we were doing was mapped out.
When we started this process, everybody in the department was interviewed to see what changes we saw that needed to be made in order to move forward. And I think that was nice to see that they respected everybody's opinions before delving into the changes. Then we broke into working groups and just pinpointed what areas we could work on.
The whole issue took commitment from and belief from upper management down to our staff, because you don't realize savings initially because you're not saving money. You're actually spending more money initially to get those staff hired, get that staff trained. But there was vast savings made by being able to get patients, particularly patients who are in hospital, into the cath lab, get their tests done and get them home. So that massively saved hospital bed days and turnaround time for patients. So not only did the patients get dealt with faster, it does save the healthcare system money.
Today we're seeing high staff engagement scores, we're seeing our turnover reduced, we're seeing a stable workforce working pleasantly in the cath lab in partnership with all of our clinicians.
Personally, it's rewarding to feel that we were a part of this process to make these changes, and knowing that now we can provide the care that we're trained to give and all our patients deserve.